Okay, so let us start with the topic. As we have the 1 week for the preparation, and our examination is on the next Sunday, so we'll have the almost 7 days. But what we are going to do is we have divided the pharmacology in the 6 topics, and we'll take the whole pharmacology that has been divided in 6 topic, and we will take one topic in each day. So today we are going to take the topic of the antimicrobial agents, and let's take the brief revision of that and what we need to focus on. What are the important criteria that we have to revise in these last days of the preparation. So let us start with the antimicrobial agents. So here, the few concepts you need to remember. The first thing is you have to remember the definitions of these agents. The number one, chemotherapy. What is this? See, what we generally understand that chemotherapy is being only used in the treatment of cancer, but that is not true. Chemotherapy means that is also being used, means that is also that also covers the therapy of treating the infection as well. So chemotherapy is not only limited to the cancer, this is also being used to kill or inhibit the growth of the microorganism as well. So antimicrobial agents, they are also known as the antimicrobial agent as well. We will see that about. But here the chemotherapy means this is the therapy which is used to kill or inhibit the growth of microorganism as well as the cancer cell. So that can be used for both purpose. Antibiotics, what we need to remember here is antibiotic, the only phrase that you have to remember is they are derived from the microorganism. See, what is antibiotics? Antibiotics are the drugs which is being derived from the microorganism, and they are used to kill or inhibit the growth of the microorganism or the cancer cell. So antibiotic and chemotherapeutic agent, the only difference is what? The chemotherapeutic agent that can be a synthetic or that can be a naturalizer. Actually, chemotherapeutic agent is a broad word. It's a broad word which includes the antibiotic, which is a natural sources from the microorganisms, and the another one is the synthetic sources. So that broad category is called as chemotherapeutic agent. In this chemotherapeutic agent we have this two subcategory. One is antibiotic and another one is a synthetic or semi-synthetic, right? So that would be in the second category. So this is a broad category and antibiotics would be in that. But that may be a question for us in the GPAT. What is antibiotic? So the antibiotics are being derived from the microorganisms. That's very important thing. The another thing is chemotherapeutic index. What is chemotherapeutic index? Chemotherapeutic index, it is a range. It is a range between MIC, that's a minimum effective concentration or minimum inhibitory concentration, to the MSC, that is a maximum safe concentration. So that is a range, right? It is a range between the MIC to MSC. In case of chemotherapeutic, we use the MIC, but in case of simple therapeutic index, we use the MEC, minimum effective concentration. So chemotherapeutic index and therapeutic index would be same, but chemotherapeutic index would be for antimicrobial agents. So here we are writing the minimum inhibitory concentration, right? So MIC, minimum inhibitory concentration, to the maximum so safe concentration. This range is called as chemotherapeutic index. So here just we need to see the 2 or 3 important phrases. The number one, chemotherapy is not only limited to the cancer, that can be also used to kill the microorganism or inhibit the growth of microorganism. Number two, antibiotics are being derived from the microorganism only, right? That is being derived from the microorganism only, while the chemotherapeutic agent can be a synthetic source as well. What is chemotherapeutic index? So it's a range between MIC and MSC. Okay, now let's see the classification. See, classification, we will not mug up everything. What we will do is we will not mug up the everything, that we have the various 5 ways how we can classify the antimicrobial agent. But what we will do is we'll remember the important things that is helping you out in answering the question. Like someone is asking you कि identify all of the following are beta lactam antibiotic, except, now most of the people are knowing that penicillin and cephalosporin are the beta lactam antibiotics. They knew that, but majority of are missing these two categories. The one is a carbapenem and another is a monobactam. So these two things that is important for us, that beta lactam, there are not only two, penicillin and cephalosporin, they are not just the beta lactam. The another two categories that includes monobactam and carbapenem. So that is what I have highlighted. right? We won't remember the sulfonamide, that we all know that it contains the sulfur, and that all the drugs start with the sulfo, so that is easy to remember. Diaminopyrimidine, yes, that's we have the category in the anti-malarial drugs, where trimethoprim and pyrimethamine are belonging to that. Quinolones, that we also know, and we'll see the quinolones in a detail in the next few slides. But here the what I've highlighted is beta lactam. So beta lactam is an important point for us, right? I have star marked here, which are the monobactams and carbapinums. These are the two another categories that are also belonging to the beta lactam antibiotic. Tetracycline, easy, we know that. Nitrobenzene derivative, that is also easy, chloramphenicol. But aminoglycoside, yes. See, aminoglycosides, they most of the category or most of the drugs, they have the mycin, like except here amikacin. But streptomycin, gentamicin, neomycin, they all are belonging to the aminoglycosides. Aminoglycosides, they are not being given orally. We will see the specific category and specific details about the aminoglycoside, but here we will remember just the example. Macrolide, they have the thromycin. Mycin तो है, उसके अलावा they have the thro, that is erythro, azithro, roxithro, clarithro. They are the thromycin, so they are macrolides. Lincozamide, we have the only two drugs here. They also have the mycin, but we have the only two agents here. The one is easy because they name the linco, so lincomycin, and another is the clindamycin. So this is a one important question that can be asked. See, that few those who are differing from the category, they are important for us to be asked. They are having the most probability to ask the question. Like if you've been asked, okay, clindamycin is belonging to the which category of antibiotics? And they give an option aminoglycoside, they give an option of beta lactam, they give an option of lincosamide, and they give an option of macrolides. So in that case, you should know, right? You cannot assume that mycin means it must be have the aminoglycoside. No, that is not like so these are the two names that you have to remember. One is a clindamycin. Lincosamide is very easy, right? Because lincosamide means lincomycin, that we all understand it and correlate it. But clindamycin, where we cannot where we have to remember the name. The clindamycin is belonging to that category, so that's about the clindamycin. Then next is the glycopeptide. That is also another one important topic that can be asked. He identify the category of the vancomycin, or vancomycin belong to which category of antimicrobial agent. So vancomycin is belonging to whom? That is glycopeptide. That is another thing. So here what I have highlighted in a red in color, they are important for us and you should revise that, right? Teicoplanin and vancomycin. Teicoplanin and vancomycin, they are belonging to what? They are belonging to the glycopeptide. Glycopeptide, yes. Linezolid is mostly the antibiotic which is being used for the smooth muscle infection, right? Soft tissue infection, that is the main indication for this. And we'll see it's an protein synthesis inhibitor. We will talk about it. Polypeptide, yes, another highlighted category for us. Polypeptide, which are the polypeptides? So polypeptide antibiotics, these are the polymyxin B, colistin, bacitracin, and tyrosine, right? Polymyxin B, colistin, bacitracin, tyrosine, they are polypeptide antibiotics. And another thing is nitrofuran, nitramidazole, easy. Nicotinic acid derivative, which are they are the anti-tubercular drug. Which are it? They are one, isoniazid, pyrazinamide, ethionamide, right? Isoniazid, pyrazinamide, ethionamide, they are the nicotinic acid derivative, so it is important for us. The another is Pollen antibiotics, yes. Which are they are antifungal agents, including the nystatin, amphotericin B, and hemicin. These are the pollen antifungal agents actually, and they are the nystatin, hemicin, and amphotericin B. So remember this. Azole तो easy है, ठीक है. लेकिन what are the things that we have to remember here is those which are highlighted with the red in color, they are more important, and you have to focus on it. जो सबसे अलग है ना, उस पर ज्यादा फोकस करो. क्या है जो सबसे अलग है कैटेगरी में, जो सबसे अलग आ रहा है उस पर पहले फोकस करो. वही चीजें पूछी जाती हैं जो आइदर दैट वुड बी ऑन अ टॉप, मिस वो सबसे टॉप पे है या सबसे लास्ट में है, वो पूछी जाती है, या तो सबसे नाम अलग है जिसका, वो पूछा जाता है, राइट? सो हियर वी हैव द बीटा लैक्टम. तो बीटा लैक्टम में ये दो जो हैं, मोनोबैक्टम एंड कार्बापिनम, right? Remember these two names. Aminoglycosides, most of the agents, they have the mycin, neomycin, kanamycin, gentamicin, and they are not being given orally. they all are being used either the topical agents or through the parenteral route only. Macrolides, thromycin, that would be easy. Lincosamide, clindamycin, specific, remember the clindamycin. Glycopeptide, teicoplanin and vancomycin. Polypeptide, polymyxin B, colistin, bacitracin, tyrosine, right? Nicotinic acid, isoniazide, pyrazinamide, ethionamide. Choline, which are the choline? They are the antifungal agents. And nystatin, hemicin, amphotericin B. Amphotericin B, remember about the amphotericin B, it is one of the most nephrotoxic agent. We have actually two preparations of amphotericin B available. The one is a conventional formula, which is most nephrotoxic. Another is a liposomal injections are available of the amphotericin B, which is less nephrotoxic. You might have heard about the COVID-19, right? After the COVID-19, there was a complication that was a mucormycosis, and in mucormycosis, the most effective agent was the amphotericin B, where liposomal injections of the amphotericin B were given to treat the mucormycosis. And amphotericin B, there are two preparations available in the market. One is a conventional formula, which is a more nephrotoxic, and which are cost effective as well. The cost of the amphotericin B, which is a conventional formula, it is costing around 300 rupees per vial, while the liposomal formula, which is available in the market, which is costing around 5,000 something, 5,000 to 15,000. So that would be very costly, right? So here we've seen about the chemical, right? This chemical classification would also help you to cover the questions of the medicinal chemistry as well. So you can read, or you can prepare these two subjects together. That would be more easy, because majority of the questions of the medicinal chemistry and pharmacology, that would be interconnecting. Okay, next is what? Next is the which are the antibacterial, antifungal, antiviral. That is easy, and we all know that, right? Antibacterial kya hai? Antifungal, yeah. Here you can remember the few names of the anthelmintic agent that can help to cure the helminthiasis infection, and where the mebendazole, pyrentyl pomoate, niclosamide, and diethyl carbamazine, that these are the few important agents for that. बाकी सब ठीक है. Next है, based on the spectrum of activity, actually this is the narrow spectrum. Narrow spectrum is which is covering only few microorganisms, but in earlier category, like if you talk about the penicillin, so penicillin G was the first natural penicillin molecule, and that initial molecules were the narrow spectrum, but later on the new molecules that were came into the market, like aminopenicillins, they were the broader spectrum antibiotics. So that was actually not true, but we cannot tell the whole penicillins are the small narrow spectrum. It is not true for us. The earlier molecules were the narrow spectrum, but the new molecules which are entering into the market, they are a broader spectrum, right, from the penicillin as well. So you cannot stick to the only the penicillin is the narrow spectrum. That is not true. Earlier molecules of the penicillins category, they were narrow spectrum, but the new molecules, like latest molecule, that aminopenicillins, they were in this, or extended spectrum penicillins, they are in the broad spectrum antibiotic. This was for broad spectrum, the tetracycline and chloramphenicol, which was mentioned in the book, but nowadays we have the many broad spectrum antibiotics available. Okay, so now let's see, the another thing important here is bacteriostatic and bactericidal. Which are the drugs that is belonging to the bacteriostatic, which are the drugs belonging to the bactericidal. So bacteriostatic means those who are inhibiting the growth, they are static, and bactericidal means which are the killing the microorganism, they are cidal. So cidal, easy, they kill the microorganism. Static, they inhibit the growth. But how do we understand, or how do we think, or how do we correlate, okay, which are bacteriostatic? So those who are interfering with the metabolism, those who are interfering with the protein synthesis, they can be static. क्या है? Those drugs which inhibit the protein synthesis, those drugs which interfere with the metabolism, that mostly they belong to the category of bacteriostatic. While those drugs which destroy the DNA, those drugs which destroy the cell membrane, those drugs which increases the leakage of the through the cell membrane, they can be bactericidal. So जो प्रोटीन सिंथेसिस इनहिबिट कर रहा है, ठीक है, प्रोटीन सिंथेसिस इनहिबिटर्स, those who are interfering with the metabolism, that can be bacteriostatic. While those who are damaging the DNA, those who are damaging the cell wall, those who increases the permeability through the cell wall can be bactericidal. So आपको अगर mechanism base कुछ याद है, तो आप उसके साथ उसका कोरिलेशन कर सकते हो कि कौन सी बैक्टीरियोस्टेटिक हो सकती है, कौन सी बैक्टीरियोसिडल है। आप यहाँ पे जो भी यहाँ पे दिख रही देखिए सल्फोनेमाइड्स, तो दे आर इनहिबिटिंग द फॉलिक एसिड सिंथेसिस, टेट्रासाइक्लिन प्रोटीन सिंथेसिस इनहिबिटर, क्लोराम्फेनिकोल is a protein synthesis inhibitor, erythromycin it is also the protein synthesis inhibitor, clindamycin linozolid that is also protein synthesis inhibitor. So these all are the bacteriostatics, right? While the bactericidal, let's say penicillin, so penicillin, what are they doing? They are damaging the cell membrane, they are inhibiting the cell wall synthesis by inhibiting the transpeptidase enzyme, they inhibit the synthesis of peptidoglycan, so cell membrane nahi banega, so that is sidal. So penicillin, cephalosporin, vancomycin, aminoglycosides. See, aminoglycosides, they are also inhibiting the protein synthesis and they have the another mechanism as well. Aminoglycosides जो हैं उनका दो mechanism है. Number one, they inhibit the protein synthesis by inhibiting the 30S ribosomal subunit, and number two, they are also causing the misreading of mRNA and they produces the faulty proteins, and because of that they also have the bactericidal property. सो दैट इज द रीजन, ये आप यहाँ पे मैंने इसको स्टार मार्क कर दिया है, यू कैन रिमेंबर दिस नेम ऑफ दिस कैटेगरी, राइट? एमिनोग्लाइकोसाइड. सो एमिनोग्लाइकोसाइड can be that is having the bactericidal property, right? So bactericidal property, so here, yeah, you can remember here. And the another is polypeptides, rifampin, isoniazid, pyrazinamide, quatrimoxazole, metronidazole. See, metronidazole also a DNA damaging drug है. It's producing the free radicals that causes the damage to the DNA. So metronidazole, it's a DNA damaging drug, and that is why it is a bactericidal. Fluoroquinolone, that is inhibiting the uh, uh, it is inhibiting the enzyme called as DNA gyrase. DNA gyrase को inhibit कर रहा है, इसकी वजह से क्या होता है कि उसका जो नेगेटिव सुपर कोइलिंग होता है, जो DNA जो सर्कुलर DNA होता है उसका अनवाइंडिंग जो है वो inhibit होता है, that is why the whole process is DNA synthesis has been blocked, and that is having the bactericidal property. So this is another important thing. Number this last classification is based on नहीं अभी एक और है, that is based on mechanism as well. Here we are going to see this isolation, like which are the sources of the antibiotic. See, this is another important thing. What they ask is, they can ask the penicillins are isolated from which organism? Bacteria, fungi, viruses, actinomycetes. So yes, they are isolated from the fungi, the Penicillium notatum and Penicillium chrysogenum. So they are the fungi. So griseofulvin, fungi, that is also the antifungal agent, and it is being isolated from the fungus itself. So ये एक हमारे लिए important नाम है. देखिए क्या क्या है नाम? Griseofulvin. Griseofulvin is an antifungal agent. It's an antifungal agent, and it is being isolated from the fungi itself. Penicillin, cephalosporin, they are the antibacterial agent, they are isolated from the fungi. Bacteria, so that this polypeptide antibiotics, see polypeptide, right? ये polypeptide है, कौन से? Polymyxin B, colistin, bacitracin, these all are the polypeptide antibiotics. They are being isolated from the bacteria itself. Bacteria, tyrothricin, that is also from the bacteria, Astrionum also from the bacteria. So these are the bacteria, these are the antibiotics which are being derived from the बैक्टीरिया. इसको हम एंटीबायोटिक्स बोलेंगे. क्या बोलेंगे? वी आर कॉलिंग इट एज एन antibiotics. Why we are calling it as an antibiotic? Because they are isolated from the microorganism. Yes, they are isolated from the microorganism, and that is why we can call it as a antimicrobial agent. You see, right? Another source of the another source of the drug is actinomycetes. Now what is actinomycetes? Actinomycetes, they are a derivative of the gram positive bacteria. So ये जो ग्राम पॉजिटिव बैक्टीरिया है उसके ही डेरिवेटिव हैं. So and these are these this is a separate category that we consider actinomycetes, and that is the drugs which is being isolated from the actinomycetes are the aminoglycosides, tetracycline, chloramphenicol, the old broad spectrum antibiotics. They are being isolated from the actinomycetes. Macrolides, that is also from the actinomycetes. Pollen antifungal agent, right? Which were the pollen antifungal? So pollen antifungal, they were the amphotericin B, nystatin, hamicin. They were the pollen antibiotic, right? So these pollen antibiotics, they are isolated from the actinomycetes, chloramphenicol, macrolide, tetracycline, aminoglycoside. These all are isolated from the actinomycetes. So this is one of the important table of this slide. Next जो है, that is based on the mechanism. See, another way of classifying the antimicrobial agent is based on mechanism. ये भी हमारे लिए इम्पोर्टेंट। ये सारी चीजें मैंने आपको इसीलिए बता रहा हूँ ना कि दे आर पोटेंशियल questions that can be asked from the for the GPAT, right? So this tables and classification, the mechanisms, the specific adverse effect, the particular indication, these are the few things that you shouldn't skip, and that you have to read it, right? So that this is a very important thing, and we should not skip it, and at the end time we have to revise this whole content, and that is why we are looking it for. Okay, chalo, so mechanism ke base pe the one cell wall synthesis inhibitor, cell wall synthesis inhibitor, the all the beta lactam antibiotics, right, like penicillin, cephalosporin, carbapenem, monobactam, they are cell wall synthesis inhibitor. Other than this bacitracin, which is an polypeptide antibiotic, then cycloserine, then vancomycin. Vancomycin, we've seen that, right? And vancomycin is belonging to which category? The vancomycin was belonging to the chemical class. It was a glycopeptide antibiotic. Yes, glycopeptide. So vancomycin, yes, vancomycin, glycopeptide. So vancomycin is cell wall synthesis inhibitor. Next is the drugs which causes the leakage from the cell membrane. So what they do is they damages the cell membrane, causing the leakage. So the antifungal agents, Polin antifungal agents, the amphotericin B and polypeptide antibiotics, polymyxin B, colistin, bacitracin and polin. Polin में कौन सा है? Polin में तीन थे, right? Amycin, nystatin and amphotericin B. These all agents, they what they do? They causes the leakage. They get entrapped into the cell wall. What they do is they get involved into the cell membrane, and they causes the pores into it. Pore formation occurs, and then the content of this cell will be leaked out. So these drugs belonging to this category, polymyxin B, colistin, bacitracin and amphotericin B, they causes the leakage. Next, inhibit the protein synthesis. So these are the protein synthesis inhibitor. What we will do is, this is very important for us, and this we will divide it into the two major categories. The number one, protein synthesis. See, in the there are the antimicrobial agents which are inhibiting the protein synthesis into the microorganism. They are not affecting the human cell protein synthesis. What is the reason? The reason is what? The human cell ribosomes, they have the different subunit than the bacteria or the organism. The human have the 60S and 40S ribosomal subunit, while the bacteria have the 30S and 50S ribosomal subunit. So bacteria is having the 30S and 50S, while the human cell, which are the ribosomes of the human cell, so that is 40S and 60S. So 40 and 60, human is having 40-60, while the bacteria is having 30-50, and that is why the antibacterial agents which is affecting the protein synthesis into the bacteria, they are not affecting the bacterial synthesis, they are not affecting the protein synthesis of the human. This is the reason behind it, so that we can keep in mind. Okay, so we have bacterias have the 30S and 50S ribosomal subunit. Now what we will do is we'll divide the drugs. So 30S रिबोसोमल सब यूनिट के साथ बाइंड करके प्रोटीन सिंथेसिस इनहिबिट करने वाली ड्रग्स कौन सी है? सो उसके लिए हम याद रखेंगे 80-30. क्या याद रखेंगे? 80-30. ए फॉर एमिनोग्लाइकोसाइड, टी फॉर टेट्रासाइक्लिन. क्या याद रखेंगे यहाँ पे? ए फॉर एमिनोग्लाइकोसाइड एंड टी फॉर tetracycline. So that is why 80-30. So they will bind with the 30 and inhibit the protein synthesis. 50S के साथ क्या है? तो 50S के साथ है CM50. क्या है? CM50. So ये C stands for chloramphenicol, M stands for macrolide, एंड उसके अलावा 50S में और भी दो आती हैं. कौन सी दो आती हैं? ये क्लिंडामाइसिन एंड लिनेजोलिड. दीज आर द अनदर टू एजेंट्स व्हिच इज आल्सो बाइंड्स विद द 50S रिबोसोमल सबयूनिट एंड इनहिबिट द प्रोटीन सिंथेसिस. सो क्लिंडामाइसिन, ये क्लिंडामाइसिन भी इसमें आएगी 50S में, एंड लिनेजोलिड भी 50S में आएगी. सो लिनेजोलिड, सो इसमें CM50 के साथ साथ दो और ड्रग इसमें आएंगी. कौन सी? क्लोराम्फेनिकॉल है, मैक्रोलाइड्स हैं, क्लिंडामाइसिन, लिनेजोलिड. दे बाइंड विद द 50S, inhibit the protein synthesis, while here we have the 30S ribosomal subunit में हमारे पास क्या है? 80-30, that is aminoglycoside and tetracycline 30. ठीक है. ओके, नेक्स्ट है क्या है, तो these are the drugs which is causing the misreading of mRNA. We all know there are the three processes. One is a replication where the one DNA is divided into the two daughter DNA. The next is the transcription where the mRNA is being formed from the DNA. So DNA so from the mRNA is being synthesized from the DNA, that would be called as transcription. And the third one is what? Third one is a translation. Translation का मतलब क्या है? So translation means the proteins are being formed from the mRNA. So these are the drugs which causing the problem during the transcription and sorry, translation. And what they do is they will misread of the mRNA and causing the abnormal protein synthesis. Because of that, the bacteria would be killed. So here example is only the category is available. Here it is aminoglycosides. Aminoglycosides having the two mechanisms. One is they are causing the misreading of mRNA. Another is they inhibit the protein synthesis. Which protein synthesis? By binding with the 30S ribosomal subunit. So that is about the aminoglycoside. Okay, DNA agarase, that's a specific another category called as fluoroquinolones. Quinolones and fluoroquinolones, they bind with this enzyme and inhibit it. So fluoroquinolones, they work through this mechanism. So only one category. What is that? That is fluoroquinolones. And what is for misreading? Only one category. What is that? Aminoglycoside. So very easy. So another thing is the drug which interfere with the DNA function, that is DNA polymerase, DNA dependent RNA polymerase inhibitor, which is a rifampin. So rifampin is interfering with the DNA function, and those drug which is interfering with the metabolism, which are they? Sulfonamides, sulfones, trimethoprim, pyrimethamine, paraaminosalicylic acid, metronidazole. Metronidazole is also DNA damaging drug by producing the free radicals. So free nitro radicals are being formed because of its destruction, and these free nitro radicals causing the damage to the DNA. So they interfere with the functions and the metabolism. So these are the drugs. So this is a table which we have to prepare. Okay, now let us see the individual antibiotics. Now what we are going to see is we are going to see the individual antimicrobial agents. So number one, sulfonamide. So here in sulfonamide, what we will remember and what is important for us? Do we remember? Do we have to read the whole chapter and have to remember the everything? No, there is no need of it. What we have to remember is we have to remember the classification. We have to remember the mechanism of that particular drugs, adverse effects specifically associated with this category. We want see here we are not going to write the descriptive questions where we were writing the nausea, vomiting, diarrhea, hypersensitivity. These are the few adverse effects that you find in all the category of drugs. But here we are not going to write the descriptive, right? We are going to be appearing in the examination of GPAT, where we have the MCQ and to the point question, to the point answer is being needed. So here we have to remember the specific adverse effect which is associated with that category or the drug, right? So here in this sulfonamide we will remember this content which I mentioned here in this slide. So classification, yes, classification, we have to read the classification, all the chapter. Say if you want to do the pharmacology, so pharmacology, all the classification is very essential and you have to read it anyhow, and you have to remember this classification is must, right? You cannot skip the classification. Suppose you are skipping the chapter, like the you are skipping and you are keeping an option, like you are the anti-amoebic drug, you are keep skipping that, but you should not skip the whole chapter. You can do the mechanism and classification. That's very essential, and majority of the questions would be related to that point only. So let's see. Sulfonamide, we have the four categories here. The one, short acting, that is diazine; intermediate acting, that is methoxazole; long acting and special purpose, which is used in a special purpose. See, sulfadiazine, which is a short acting, which is being combined with this silver, and they are being used into the burns. So they have this specific indication. The creams are available and we are being used, so they are used into the burn patient. So someone who has got burn, the silver sulfadiazine 1% cream are available into the market. You just put a silver sulfadiazine on the burns, and that can help into the preventing the infection to that burn area. So silver sulfadiazine is a special drug available for that indication. Sulfamethoxazole, which is an intermediate acting, and we will use this drug in combination with the trimethoprim, and this combination now it is called as cotrimoxazole. So that's a combination, right? Sulfamethoxazole plus trimethoprim, 4 portion is actually 5:1. That's the dosing ratio that is being used. So 5 portion of sulfamethoxazole and 1 portion of trimethoprim will combine it together, and now that combination is known as cotrimoxazole. Cotrimoxazole is a co-tree, co for combination, tree for trimethoprim, and moxazole, that is for sulfamethoxazole. So this is how it is being named. So this is cotrimoxazole is very important, and you need to remember the indications where this is the only combination which is most widely used for the systemic purpose. सिस्टेमिक पर्पस में सबसे ज्यादा अगर कोई सल्फोनेमाइड यूज होता है तो वो ये कॉम्बिनेशन है, कौन सा? कोट्रिमोक्साजोल वाला. Okay, then sulfadoxine and sulfamethopyrazine, they are the long acting sulfonamide, and they are being generally used in combination with the pyrimethamine. किसके साथ कॉम्बिनेशन में यूज होता है? पायरीमिथामाइन. कहाँ पे? तो इन केस ऑफ द क्लोरोक्वीन रेजिस्टेंट मलेरिया, right? So plasmodium falciparum, this is a combination, this is a specific indication for this drug. So long acting sulfonamide, which is a sulfadoxine and sulfamethopyrazine, they are used in combination with the pyrimethamine, with for treating the chloroquine resistant plasmodium falciparum infection. Okay, now what is a special purpose drug? See, we remembered this is for burns. Yes, good. Sulfacetamide is a water soluble drug, and it is available into the eye drops. Yes, eye drops. And why they are being used? Yeah, they are being used for the ophthalmic infection, like you can say that, like conjunctivitis. Yes, conjunctivitis means what? It is an inflammation of the conjunctiva. So the redness of eye, yes, that is an infection of the conjunctiva, where we use the sulfacetamide solution. Sulfasalazine is also having the one specific indication. They are being used in the treatment of ulcerative colitis and rheumatoid arthritis. It is having the anti-inflammatory property, and we can use it into the treatment of ulcerative colitis. It's a part of it's a type of IBD, inflammatory bowel disease, right? Inflammatory bowel disease, they have the two subtypes. One is ulcerative colitis and another one is Crohn's disease. So ulcerative colitis is where it is being used. So, and another is rheumatoid arthritis. Mefenide is also the sulfonamide which is being used topically. It is also a topical sulfonamide, and this topical sulfonamide, we generally use it for the Pseudomonas infection. So this is the one which is also effective in Pseudomonas aeruginosa. So this is a very specific thing that we can remember here about it. Pseudomonas, right? Pseudomonas infection. So this is about the few things that we can remember here. What is the mechanism here? The mechanism is they are inhibiting the enzyme called as dihydropteroid synthase. It is also named as folate synthase. So that is another name. So what is the another name of the dihydropteroid synthase? It is a folate synthase. So they are inhibiting the enzyme. What is that? Dihydropteroid synthase, or it is also known as folate synthase. And that is why they inhibit the folic acid synthesis into the bacteria. See, the bacteria, they have the capability to synthesize the folic acid by making the combination of PABA, which is a para-aminobenzoic acid, with the pteridine ring. So this is a combination that can happen into the bacteria, and they can form the folic acid by the help of this enzyme. While the human, they cannot synthesize this. They cannot synthesize the folic acid. Folic acid is an essential supplement for us. We human cell cannot synthesize the folic acid, and that is why this enzyme, which is named as dihydropteroid synthase, is absent into the human. Human does not have this enzyme. Which is that dihydropteroid synthase. So you can remember the mechanism by one liner. What is that? Dihydropteroid synthase inhibitor. Yeah, so you can also call it as folate synthase inhibitor. What are the specific adverse effects associated with the sulfonamide? See, the sulfonamide, they are excreted into the urine. They are excreted into the urine, and they get precipitated into it. the urine is having the acidic pH, right? Urine is having the slight acidic pH, and in this acidic pH it gets precipitated and it forms the crystal in it, and that is why it is known as crystalluria. Crystalluria in acidic pH of urine, the sulfonamide which is excreted into the urine, that get precipitated, and that is the reason why it forms the crystal into it, and that adverse effect is known as crystalluria. So how, what is the solution for it? What is the solution for crystalluria? So the solution for the crystalluria is by alkalining the urine. So what you can do is you can make the pH of the urine alkaline. So how do we make the pH of urine alkaline? So by giving the NaCO3. So NaCO3, it is a treatment. It is a treatment for crystalluria. So if someone asks you how the crystalluria is being treated, the crystalluria is being treated by giving the NaCO3 solution or by making the urine alkaline. Okay. The another is a Steven-Johnson syndrome. That's a very specific thing where the epidermal necrolysis means the epidermis of the skin that get damaged or that get destroyed. So that is why it is called a Steven-Johnson syndrome. Epidermal necrolysis, the another name of it. What is the another name of Steven-Johnson syndrome? It is called as epidermal necrolysis. Okay. The another thing is G6PD deficiency patient. Those who have the G6PD deficiency, they have the hemolysis. Hemolysis would occur in patients who is having the deficiency of G6PD enzyme. So G6PD enzyme deficiency के अंदर that causes the hemolysis. So there are major drugs. There are few drugs as well that you can remember here, like the trimethoprim, pyrimethamine, right? These are the anti-malarial drug. Then another thing that I can remember we can remember here is methyl dopa. They can also causes this. What they do, this trimethoprim, pyrimethamine, methyl dopa, sulfonamide, these all drugs can produces the hemolysis in patient who is having the deficiency of G6PD. So important. Okay, next, kernicterus. It's a very specific adverse effect that can appear into the newborn babies, those who were given with the sulfonamide. So it means those who lactating mother or the pregnant woman, if they given with the sulfonamide, that chances of the kernicterus would be more in the newborn babies. So kernicterus, yes, that's a specific adverse effect of the sulfonamide that would appear into the newborn babies. Okay, now what I told about you, that is cotrimoxazole. I talked about it before here, right? We've talked about the cotrimoxazole. It's a combination. Co means combination. Kiska? Trimethoprim with methoxazole. So that is what is a combination of 5-GAM1. And what is the specific thing that you have to remember here is very important thing is it's a first choice agent for the treatment of urinary tract infection. So if you've been given an option, if you've been given a question, okay, identify the drug which is a first choice agent for the treating the urinary tract infection. If you got an option like cotrimoxazole, number 2 like the fluoroquinolones. Fluoroquinolones are also being used in the UTI infection, but that would be given only when patient is having some complicated UTI, right? Complicated UTI, that would be a specific indication for the fluoroquinolones. They are also being preferred in the UTI, but here the cotrimoxazole would be the first choice in the uncomplicated UTI. Like patient is not uncomplicated UTI, what would be the first choice? Cotrimoxazole. Another thing is what? The another thing is pneumocystis jirovecii. This is an organism, right? Pneumocystis jirovecii, that is an organism. क्या है ये? Organism है. क्या करती है? So that causes the pneumonia in patients who is having the neutropenia या तो फिर HIV. जिन लोगों के अंदर WBC count कम होता है, those who are immunodeficient patients, they have the infection of the pneumonia that is being caused by this pneumocystis jirovecii. This is an organism which is causing the pneumonia into the neutropenic and HIV patients. So this name also important for us, right? If you've been asked question, okay, which organism, that could be a question of microbiology subject. Okay, which organism is responsible for causing the pneumonia in HIV patient? And you've been given an option: Streptococcus pneumonia, the pneumocystis jirovecii. The other options were also being given, H influenza like. So in that case, pneumocystis jirovecii would be the first answer for it. There are if you've been asked if the patient is having the normal patient, like he or she is not having any neutropenia or no having no HIV, then which organism could be the reason for the causing the pneumonia? The answer is what? The answer is Streptococci pneumonia. That would be the first organism. Number would two would be H influenza. So H influenza and pneumonia, Streptococcus pneumonia, they are the organism which is responsible for causing the pneumonia into the normal healthy person, right? While in HIV and in neutropenic, the pneumocystis jirovecii. Okay, next, quinolones, fluoroquinolones. What we will remember here? What we will remember here in quinolones and fluoroquinolones? So the important thing is the only quinolone is nalidic acid, while remaining all other molecules which is available, they all are the floxacin, which is a fluorinated molecules, and that's on the seventh carbon the fluorination occurs. So that is fluorinated molecules are called as fluoroquinolones, while only quinolone, that is on only quinolone is what? Nalidic acid. They can be divided into the first generation and second generation. So the earlier first line could be the first generation and second line could be the second generation. There are other molecules as well, like a sparfloxacin, gemifloxacin. There are other molecules as well, but these are the most common molecules that are being preferred, so I've written only two. So the thing is, what is the difference between this? The earlier first generation molecules, they were specifically for being given to the patient who is having the gram negative organism infection, right? Those who have the gram negative organism infection, in that case the first generation would be preferred, while the those who have the gram negative and positive were the second generation. That is what a broad spectrum, right? And that is what the advantage of second generation fluoroquinolones. What is the mechanism? They inhibit the enzyme. Which is the enzyme? DNA guidase. What is the another name of it? The another name of it is a topoisomerase 4. Topoisomerase 4, or it is also known as DNA guidase. If you inhibit this enzyme, what would happen? They inhibit the negative supercoiling of DNA. See, sometimes what they are asking, they are not asking the enzyme name. So if they've been asked question like, what is the mechanism of ciprofloxacin? And in that question they haven't mentioned the name of the enzyme. Like उन्होंने mention नहीं किया कि भाई they inhibit the ciprofloxacin, inhibit the DNA gyrase or topoisomerase. But what they mentioned कि ciprofloxacin is inhibiting the negative supercoiling of DNA. So sometimes if you remembered only the name of enzyme would also limiting the answer, limiting the probability of answering, right? So here you need to remember, okay, that you have to understand what is the function of the DNA gyrase. So DNA gyrase, or which is a topoisomerase 4, it is inhibiting the negative supercoiling, and another thing is what they are separating, they are inhibiting the separating of daughter DNA from the parent DNA. So this is the reason, that is what you can correlate here. Where this category of agents are being used, this category of agents are specifically indicated for the complicated UTI. Yes, they would be the first choice agent as a diarrhea as well. Ciprofloxacin eye drops available hai, or they are also being used in the conjunctivitis. Levofloxacin is another must and first most molecule which is being treated, which is being used to treat the pneumonia. The fluoroquinolones, they are also a second line choice of drug for treating the tuberculosis, and that can be used in the MDR TB or extensive resisted TB. So in that case the fluoroquinolones can be used, but in a normal TB we want to give the fluoroquinolones as a first choice, right? We have the only HRZES, that is isoniazid, rifampicin, pyrazinamide, ethambutol and streptomycin. They are the only 5 agents which is available as a first choice for the treatment of the TB in a first patient, right? Those who have the first time infection of TB, in that case these are the only 5 agents we will use. Except tuberculosis, all other indication are the first indication, means they are the first choice agent, first choice indication. Diarrhea, yes, of course, first choice. Conjunctivitis can be first choice. Pneumonia, first choice, levofloxacin. Specifically complicated UTI, yes, of course, the first choice agent. Ofloxacin and norfloxacin is most widely used agent for it, right? We are not preferring the second generation for treating the UTI. We are preferring mostly the first generation, like norfloxacin and ofloxacin. They are the most widely used agent for that particular thing. Here the toxicity is very important. What is that? These fluoroquinolones are CNS toxic. They causes the seizure, or they can causes the neuropathy. The another thing is they can also be causing the phototoxicity. Phototoxicity is also present into the tetracycline as well. phototoxicity. Phototoxicity is present into the fluoroquinolones as well as into the tetracycline. QTC prolongation. QTC prolongation is another adverse effect which is important, and that can be present in another category other than the fluoroquinolone. QTC prolongation is also present in the erythromycin, so in the macrolide. So QTC prolongation. Tendinitis. This is a very specific adverse effect. Tendinitis. What is tendon? Tendon is a tissue which is connecting the muscle with the bone. What is tendon? Tendon is a tissue which is connecting the muscle to the bone. That is called as tendon. There is another tissue called as ligament. Ligament and tendon, these are the two different tissues, right? Ligament means it's a tissue which is connecting the two bones together. So we know that the radius and ulna, these are the bones present in the upper part of the upper bone, upper hand. So in the radius and ulna, they are being joined together by the ligament. But tendon, what is tendon? Tendon is a tissue which is connecting the bone with the muscle. And this tendinitis means inflammation of the tendon, or the rupturing of the tendon would be the problem with this fluoroquinolones. So it is another specific. You won't find this adverse effect in another drugs. So you won't find it in another drug. So it is why these specific words you have to remember about this category. Okay, fluoroquinolone. So we need to remember about tendinitis, phototoxicity, QTC prolongation, right? CYP1A2 inhibition. This is another thing that you can have correlate here. CYP1A2 inhibitors. So these drugs are the inhibitors of which enzyme? Which CYP enzyme? It's a CYP1A2 enzyme. Okay. See, fluoroquinolones are contraindicated into the pregnancy. Why? Because they are inhibiting the synthesis of cartilage inside the fetus, and that is why they are contraindicated. Right? Why they are being contraindicated? Because they are inhibiting the synthesis of cartilage, or cartilage development inhibition. That's the biggest problem, and that is the reason why we are avoiding these drugs into the pregnancy. They are bactericidal agents. And see, this is a important thing about norfloxacin. They are being used only for the UTI and diarrhea. Ciprofloxacin ke liye kya hai? So this is the only fluoroquinolone that is being helpful or effective against the Pseudomonas aeruginosa. What is Pseudomonas aeruginosa? That is an organism. Which is mostly involved in the nosocomial infection, like the hospital acquired infection. अगर आपको कोई पूछे कि which are the organism that can be acquired through the hospital infection, so that Pseudomonas aeruginosa is one of them. So this is ciprofloxacin is most effective against that. So ciprofloxacin, which is a first generation fluoroquinolone that can be used for that. Okay, next, beta lactam. What we remembered about beta lactam? Beta lactam, they are the four category of drugs. Which are the four categories? We generally remember of penicillin, cephalosporin, but most of the people are missing about monobactam and carbapenem. But they are also the beta lactam. And what is the specific characteristic? How would you correlate it with the medicinal chemistry? So here I've taken the structure of the penicillin, and here the number one ring, right? Number one is a thiazolidine ring. And what is number two? Number two, this is a square ring, which is a beta lactam ring. So if you've been asked, identify the beta lactam moiety. Identify the beta lactam moiety. How would you identify? So 3C and 4th N. 3C connected with the N, that is a beta lactam ring. And this CN bond is a target for the enzyme called as beta lactamase. Right? Beta lactamase. This is an enzyme which is destroying the penicillins or the beta lactam antibiotics. Which enzyme is being destroying? So beta lactamase. This is the enzyme which destroys the beta lactam antibiotics. So those organisms who can produces the beta lactamase enzyme are resistant to the beta lactam antibiotics. Why? Because this enzyme destroys the beta lactam antibiotics, and because of that the efficacy of this beta lactam antibiotic would be reduced. So beta lactamase inhibitors are needed to add in such infections. So those infections where the beta lactamase, those organisms which can have the capability to produce the beta lactamase, in that case we have to add the beta lactamase inhibitor. कौन सी है? The clavulanic acid, yes. The next, sulbactam, and third one is tazobactam. Sulbactam, tazobactam, they are the semi-synthetic derivatives, while the clavulanic acid, they are being isolated from the Streptomyces clavularis. So this is an antibiotic. Clavulanic acid is a antibiotic because it is isolated from the organism, while these are the two semi-synthetic derivatives, and these all are called as beta lactamase. This is an enzyme which destroy the beta lactam antibiotics, right? So these three names, beta lactamase inhibitor कौन कौन से हैं? क्लेवुलेनिक एसिड, सल्बेक्टम, टेजोबेक्टम. क्लेवुलेनिक एसिड क्या है? नेचुरल, that is an antibiotic because it is being isolated from the organism, while another two are the semi-synthetic. What is the mechanism? The mechanism जो है beta lactam antibiotics, the mechanism is they are inhibiting an enzyme called as transpeptidase, जिसकी वजह से क्या होता है? पेप्टिडोग्लाइकान का synthesis नहीं होता, and because of that the bacterial cell wall synthesis not occur. So that's simple mechanism. Now let's see what the question can be asked from this. See, अगर आप उनको पेनिसिलिन में से क्वेश्चन पूछना है जीपेट में, तो दे कैन आस्क यू अबाउट a specific characteristic of the drug, या तो फिर they can ask you about कि which drug is belonging to which category. If they ask you to identify the penicillinase resistant penicillin from given below list of drug, तो इसका मतलब कि आपको पेनिसिलिनेज रेजिस्टेंट पेनिसिलिन का नाम पता होना चाहिए. पेनिसिलिनेज रेजिस्टेंट अब ये पेनिसिलिनेज कहाँ से आया? हमने तो आगे कहीं पेनिसिलिनेज बोला ही नहीं. Penicillinase is also named as beta lactamase. So these are synonym for each other. Beta lactamase. Beta lactamase. It is also known as penicillinase. So don't be confused. These two enzymes, the name of this is synonymous to each other, and they are being used interchangeably. They are being used interchangeably. Now what we need to remember here is, from this penicillin, just we need to remember this table. That's sufficient. See here, I'm not giving you the 100% I'm not giving you the guarantee that this is the only content that would be asked. That would not happen. But what we are going is, we are just revising the major content which is important for us. So we are taking care of it, right? So penicillins, natural, which is a natural molecule. The first was the penicillin G, which is also known as benzyl penicillin. And what is another name of it? It's a benzyl penicillin or penicillin G, which is a natural first molecule of the penicillin. Then that penicillin G is having the limitation that could not be given orally. Right? And that is why for the option we developed the penicillin V, that is phenoxymethyl penicillin. Then benzathine penicillin, which is a repository penicillin. So these all are called as natural. What is the specific characteristic about this natural penicillins? So they are sensitive to this beta lactamase enzyme, and they are effective only against the gram positive bacteria. Actually the penicillins were developed for treating the gram positive organism. So they were developed for the gram positive, but later generation जैसे उसमें upgradation हुआ, the molecules were come which is covering the gram negative as well. ठीक है, फिर नई जो लेटेस्ट स्पेक्ट्रम आई, तो वो तो फिर एनारोबिक और सुडोमोनास को भी कवर करने लगी. तो वो जैसे जैसे मॉलिक्यूल्स आगे आते गए, वैसे वैसे उसमें नई कैरेक्टरिस्टिक ऐड होती गई. लेकिन इनिशियली द पेनिसिलिन्स वर डेवलप्ड फॉर कवरिंग द ग्राम पॉजिटिव ऑर्गेनिज्म. Okay, here what is important for us? Important for us here is this. What is this? This is penicillinase resistant. Which are the penicillinase resistant penicillin? So here the examples are methicillin, cloxacillin, dicloxacillin and nephicillin. I made the mnemonic of it, और वो आपको मिल जाएगा. हमारा इंस्टाग्राम जो अकाउंट है उसमें से बहुत सारे, we have already almost I think 358 posts I've done on the Instagram, and these all pages which I posted, they are all important for us. So if you got a time and when are you free, you just go through it, and that will 100% help you out to cover the pharmacology questions. वो आपको 100% काम में आएंगे, और आप बाद में मुझे बोलेंगे भी सही कि सर आपने वो जो पोस्ट करा था ना, बहुत मस्त मटेरियल था और बहुत अच्छा काम में आया. एंड यस, लास्ट टाइम ऑल्सो, लास्ट ईयर जो भी हमारे स्टूडेंट्स हैं उन्होंने भी हमें रिव्यू दिया था कि सर यू द कंटेंट on the Instagram that you posted, it was very nice, and that will really help us out in the final preparation. So if you got a time, जब आप free बैठे हो, आप जब reading से bore हो गए हो, at that time you just revise that content, so that will 100% help you out, right? Pharmacology Guru, that is an Instagram ID through which you can access this. Okay, what is the limitation here? So the thing is, the specific advantage here is, these are the drugs which is the penicillin is resistant, and because of that you do not need to add the beta lactamase inhibitor here. It means what? See, it means here See, aminopenicillin, right? If you remember, the amoxicillin is the first choice of medicine. That is the first choice of antimicrobial agent that we will give the person as an for an infection. And if it won't work, we are combining with the beta lactamase inhibitor like amoxiclav, amoxicillin plus clavulanic acid. But here in penicillin is resistant, these drugs are resistant to the beta lactamase enzyme, and that is why there is no need to add the clavulanic acid or sulbactam or tazobactam into it. They are called as penicillinase resistant. Which are the name? Methicillin, cloxacillin, dicloxacillin, and nafcillin. So you just remember this name. It's very important for us. Aminopenicillin easy. We have only two molecules. It is amoxy and ampicillin, but they are penicillinase sensitive. So what it means? It means we have to add the clavulanic acid or the tazobactam or sulbactam to increase the efficiency of that. एक्सटेंडेड स्पेक्ट्रम मीन्स ग्राम पॉजिटिव ग्राम नेगेटिव तो कवर हो रहा है, उसके अलावा हम कुछ एक्स्ट्रा ऑर्गेनिजम्स भी कवर हो रही है, जैसे कि सुडोमोनास एरुजिनोसा, राइट, सुडोमोनास एरुजिनोसा. So that is another important thing. And azlocillin, carbanicillin, meslocillin, piperacillin, ticagrelin. So there are the so this table is very important. You just go through it and revise it and refresh it. Okay, what are the adverse effect here? The specific adverse effect you can remember here is the cholestasis, which is being found mostly on the penicillin G. So in a first generation penicillin or natural penicillin, they have the cholestasis. So that's a blockage of the gallbladder, right? Gallbladder duct, that is cholestasis. Then Jeris-Alzheimer reaction is a reaction of the skin, and these are the agents, they are safest into the pregnancy. So there would no be specific adverse effect, but here cholestasis that you can remember. And that's about penicillin. What's what I told about I've told about the Instagram ID, that a pharmacology group, and I posted already 358 posts on it, and these all are free, right? You can access through, and these are very important slides, and that can 100% help you out. This is a kind of slide that I put it here. I've just taken example like the acid resistant penicillin, though for that we remembered the mnemonic, and that is called as vodka, right? So penicillin B, oxacillin, cloxacillin, cloxacillin, dicloxacillin, ampicillin, amoxicillin. So these are the acid resistant. Acid resistance means that is the reason why we can give it orally. So that can given orally. So acid resistant, they are given orally. They are acid resistant. So this is how you can get this content on this ID. So if you are not following this, you can go through it and you will get this post, and you just read it out if you get a time. Okay, next, what is this? Next is a cephalosporins. Now this is an important thing that majority of people are missing. We all understand that cephalosporin can be identified by based on the cepha word before the name of the drug as a prefix. But the thing is, what they are, if they are specifically asking to identify the second generation, identify the third generation, identify the fourth generation or the fifth generation cephalosporin, how would you identify it? So this is a technique, and this is a mnemonic that we will use to here to identify the generations. ये कौन से generation की है, or what is the specific characteristic that is associated with that specific generation. Like say first generation, how would you identify it? So for the identification of the first generation, you have to identify through the cepha. So cepha would be the word that you can identify through it. But there is an exception, and what is that? That is a cephachlor. So here is a cephachlor, and which is an exception, which is available in the second generation. Actually, it is not a first generation. So cephachlor, that would be a second, while remaining all other cepha, that would be first. And the cephalosporin also for the same indication, for the gram positive. But when the generations came new, the newer generations would be including the positive, negative, and then extended spectrum as well. Second generation, they can identify by the fox or pro. So the cefuroxime, cefoxetine, ceprozil, this is how you can identify them. They are also including gram negative, and yes, as the generation progresses, the effectivity against the gram positive is declined, right? So as the generation progresses, the effectivity against the gram positive organism is declining, and gram negative is increasing, right? Third generation, this is the most commonly used generation of the cephalosporin in the market. If you've seen, the majority of the molecules that contain the cefixime या तो cefodoxime. So these are the two most widely used oral cephalosporin belonging to this third generation, and they have the capability to cross the BBB. They have the better coverage of the gram negative, and yes, they are less effective against the gram positive, so they are more effective against the gram negative. Fourth generation identified through the PIME, cefepime and cefepyrome, these are the only two molecules. These are characteristic, they have the capability to cover this organisms like staphylococcus aureus, pseudomonas aeruginosa and enterobacteriaceae. These are the organisms that has been specifically covered by this generation. The fifth generation, which is less often preferred, because if you got the resistance to this generation, we don't have any other option to cover this organism, right, which is resistant to it. So it would be on a last priority when the other drugs are not working and you don't have any other option. Then with this generation of agent we are indicating, specifically they are effective against the MRSA. What is MRSA? MRSA is a methicillin resistant S aureus. Yeah, this is very important, huh? Methicillin resistant S aureus. Methicillin resistant S means staphylococcus aureus. So this is the organism which is very resistant to the other four generations, and the fifth generation is having the specific property to inhibit this organism. So what is the specific characteristic of the fifth generation? They cover the MRSA, while the third generation, fourth generation, they don't cover it. The third, fourth, second, first, they don't cover the MRSA, but the fifth generation is covering the MRSA. So that is what the another thing advantage. Which generation is covering the Pseudomonas aeruginosa? So fourth and fifth, they cover the Pseudomonas aeruginosa, while the first, third, they won't. Right. So this is how you can remember. And the fifth generation can be identified by the SAFT-L. So here what we've written is SAFT-L. SAFT-L means see ceftobaiprol. ceftobaiprol. So SAFT साथ में L पीछे आ रहा है कहीं पे. ceftobaiprol, ceftaroline. So this is how you can identify them. So this is about the cephalosporin. Indications, adverse effect would be almost same with the penicillin. So generally this adverse effect would not be asked. The only thing is, this is a very important thing, that they mostly ask about the identification of this individual molecules and the specific characteristic which is associated with that generation. That is important, and that is why this table is important for us. Okay, next category. क्या रखें इसमें, क्या याद रखना है एमिनोग्लाइकोसाइड्स में? तो एमिनोग्लाइकोसाइड्स में आपको याद रखना है कि ये कैटेगरी, जब भी आप एमिनोग्लाइकोसाइड नाम पढ़े ना, इट इज अ कैटेगरी दैट वुड नॉट बी गिवन ओरली. ये दो ही फॉर्म में अवेलेबल है, आइदर पेरेंट्रल और टॉपिकल. टॉपिकल में आपको पता होगा अगर कहीं पे इन्फेक्शन हुआ है या वुंड हुआ है तो वी यूज अ नियोस्पोरिन पाउडर, राइट, नियोमाइसिन पाउडर. सो नियोमाइसिन पाउडर इज बीइंग यूज्ड टॉपिकली. अगर किसी को बर्न्स हुआ है, कहीं पे कट लगा है, तो वी यूज द सोफ्रामाइसिन. बट डू यू नो दैट सोफ्रामाइसिन इज कंटेनिंग द विच मॉलिक्यूल? द मॉलिक्यूल इज fremicetin, and that name, brand name is soframycin. So fremicetin is a molecule which is belonging to the category of aminoglycoside and is used topically. So ये topical है, topical का नाम याद रख लेना क्या है, नियोमाइसिन एंड फ्रेमाइसेटिन. बट द थिंग इज व्हाट, एक चीज आपको यहाँ पे याद रखनी है, नियोमाइसिन कैन ऑल्सो बी गिवन ओरली. लेकिन अभी हम बोल रहे हैं कि हम ओरली नहीं देते, और यहाँ पे मैं लिख रहा हूं कि ओरली देते हैं. व्हाई दिस कंफ्यूजन इज फॉर, सी कोई भी एमिनोग्लाइकोसाइड है ना, वो ओरली एब्जॉर्ब नहीं होता. दैट इज वेरी स्पेसिफिक थिंग अबाउट इट. क्या है यहाँ पे मैंने मेंशन किया, वो देखिए, एमिनोग्लाइकोसाइड्स दे आर नॉट बीइंग एब्जॉर्ब्ड ओरली. तो फिर क्यों देना है, ओरली एब्जॉर्ब नहीं होता तो? इट इज बीइंग गिवन टू किल द ऑर्गेनिजम्स व्हिच इज देयर इन द इंटेस्टाइन. अगर आपको इंटेस्टाइन क्लीन करना है, इंटेस्टाइन का सर्जरी करना है, और उसके लिए आपको ऑर्गेनिज्म को रिमूव करना है, तो द नियोमाइसिन वुड बी द बेस्ट चॉइस. नियोमाइसिन ओरली एब्जॉर्ब नहीं होगा, तो इट गोज थ्रू आउट द लेंथ ऑफ द इंटेस्टाइन. वो लार्ज इंटेस्टाइन तक भी पहुंचेगा, रेक्टम तक भी पहुंचेगा, और वहां पे जो भी ऑर्गेनिजम्स होंगे दैट कुड बी किल्ड बाय दिस ड्रग. अगर आप एमोक्सिसिलिन दिया तो एमोक्सिसिलिन दिया तो वो तो इंटेस्टाइन में से ही अब्जॉर्ब हो जाएगी, तो रेक्टम तक तो पहुंचेगी नहीं, तो फिर मतलब क्या? सो हम ऐसी कोई ड्रग नहीं दे सकते विच कुड बी एब्जॉर्ब टोटली, या एब्जॉर्ब हो जाए, ऐसी ड्रग नहीं देंगे. तो उसमें हमें ऐसी ड्रग देनी पड़ेगी जो एब्जॉर्ब ना हो, और इसमें नियोमाइसिन वुड बी अ गुड चॉइस ऑफ एजेंट. नियोमाइसिन वुड बी अ Good choice of agent. Another would be the vancomycin. Vancomycin can also be used. Vancomycin generally IV से दिया जाता है, लेकिन आप उसको ओरली दे सकते हैं फॉर दैट पर्टिकुलर इंडिकेशन. ओके, चलो अभी मैकेनिज्म क्या है. तो मैकेनिज्म मैंने आपको बताया था कि आपको याद रखना है एमिनोग्लाइकोसाइड. हमने याद रखा था 80-30. व्हाट इज दैट? Aminoglycosides and tetracycline. What they do? They bind with the 30S ribosomal subunit and inhibit it. But aminoglycoside is having a specific mechanism as well. And what is that? That is a misreading of the mRNA code. यहाँ पे भले ही हम उसको प्रोटीन सिंथेसिस इनहिबिटर ले रहे हैं, इसका मतलब ये हुआ कि ये बैक्टीरियोस्टेटिक होगा? नहीं, बैक्टीरियोस्टेटिक होगा अगर ये अकेली मैकेनिज्म होती ना तो वो 100% बैक्टीरियोस्टेटिक में ही लिखते. बट it is also interfering with this protein synthesis. They cause the misreading of mRNA code, and because of this dual mechanism they are bactericidal. क्या है ये बैक्टीरिसिडल एजेंट्स हैं. बैक्टीरिसिडल है. ये बैक्टीरिया का ग्रोथ इनहिबिट नहीं करते, बैक्टीरिया को मार देते हैं. So because of this dual mechanism, इसका एडवर्स इफेक्ट है ना, विच इज वेरी मोस्ट इंपॉर्टेंट. क्या है ये? 3 स्पेसिफिक एडवर्स इफेक्ट है. नंबर 1, ऑटोटॉक्सिसिटी. ऑटो मींस क्या? ईयर का टॉक्सिसिटी. पहला साइन क्या होगा ईयर का टॉक्सिसिटी होगा तो what would be the first sign of the ear toxicity? The first sign is a tinnitus. Have you heard about tinnitus? What is this? Tinnitus is a ringing in ears. कान में कुछ आपको ऐसा सुनाई देगा, रिंग जैसा, कंटिन्यूअस, जैसे भौरा घुस गया हो ना ऐसा ही सुनाई देगा. रिंगिंग इन ईयर्स कंटिन्यूअसली. You can hear that voice in a daytime, in a night time, continuously you are hearing it. That is tinnitus, and that lead to the hearing loss. Yes, लेकिन ये कब होगा? When it was used for more than continuous 5 days. कौन से एजेंट है सबसे ज्यादा होगा? तो यहाँ पे आपको याद रखना है नाक. हम गुजराती में उसको नाक बोलते हैं ना. नाक क्या है? नियोमाइसिन, कानामाइसिन, एमिकासिन. तो दिस इज आ मोस्ट. यहाँ कान कर देना उसको, हम नाक क्यों करें? हम कान, ईयर को ईयर ही बोलते हैं, कान बोलते हैं उसको गुजराती में. हिंदी में भी उसको कान ही बोलते हैं ना. या तो कान ही याद रखे ना. कान क्या हुआ? कानामाइसिन, एमिकासिन एंड नियोमाइसिन. दीज आर द मोस्ट ऑटोटॉक्सिक. नेफ्रोटॉक्सिक में क्या है? तो नेफ्रोटॉक्सिक में हम याद रखेंगे जीटीएन या एनटीजी. क्या है जीटीएन? ग्लिसरॉल टाइनाइट्रेट, जेंटामाइसिन, टोब्रामाइसिन एंड नियोमाइसिन. दीज आर मोर नेफ्रोटॉक्सिक. किडनी की टॉक्सिसिटी सबसे ज्यादा आती है यहाँ पे. क्या है? व्हाट इज द प्रॉब्लम? द प्रॉब्लम इज विद द किडनी टॉक्सिसिटी. कौन किसके साथ? नियो, टोब्रा एंड जेंटा. ओके, चलो अब न्यूरोमस्कुलर ब्लॉकेट कहाँ पे किसके साथ है? तो न्यूरोमस्कुलर ब्लॉकेट जो है दैट इज व्हाट दे कॉजेस द ब्लॉकेज ऑफ दिस न्यूरोमस्कुलर जंक्शन. बिकॉज ऑफ दैट द रेस्पिरेटरी फेलियर में अकर. ठीक है, न्यूरोमस्कुलर ब्लॉकेट, दैट वुड बी द अनदर एडवर्स इफेक्ट विद द एमिनोग्लाइकोसाइड्स. तो इसका मतलब क्या हुआ कि अगर कोई सर्जरी के लिए हम अगर पेशेंट्स को दे रहे हैं, राइट, और उसमें भी हमें मसल रिलैक्सेशन चाहिए, तो हम अगर एमिनोग्लाइकोसाइड्स भी दे रहे हैं और मसल रिलैक्सेशन भी दे रहे हैं, तो वी हैव टू थिंक ऑफ द डोजेस, राइट. वी हैव टू थिंक ऑफ द इंटरेक्शन, क्योंकि दे ऑल्सो हैव द प्रॉपर्टी टू रिलैक्स द मसल्स. और ये तो रेस्पिरेटरी मसल्स को ही रिलैक्स कर देती हैं, तो वो ब्रीदिंग में भी एबनॉर्मलिटी या इंटरेक्ट कर सकती हैं. तो वी हैव टू थिंक ऑफ इट. ओके, चलो यूजेस कहाँ पे करते हैं? तो एमिनोग्लाइकोसाइड दे कैन बी यूज्ड इन द ट्यूबरकुलोसिस एज अ सेकंड चॉइस. कंजक्टिवाइटिस या जेंटामाइसिन के आई ड्रॉप्स आते हैं, जैसे हमने फ्लोरोक्विनोलॉन्स के आई ड्रॉप्स देखे थे फॉर द कंजक्टिवाइटिस. कंजक्टिवाइटिस में ना 3 आई ड्रॉप्स आते हैं. कौन से? सल्फासिटामाइड, यस, सल्फोनेमाइड स्पेशल पर्पस. सेकंड फ्लोरोक्विनोलॉन्स, सिप्रोफ्लॉक्सासिन, मोक्सीफ्लॉक्सासिन, गटीफ्लॉक्सासिन, वो सब के आई ड्रॉप्स आते हैं. थर्ड जेंटामाइसिन, एमिकासिन, उसके भी आई ड्रॉप्स आते हैं. ठीक है, उसके अलावा सेप्टिसेमिया में यूज कर सकते हैं, प्लेग में यूज कर सकते हैं. बहुत सारे उसके इंडिकेशंस हैं, बट दीज आर द फ्यू मेजर इंडिकेशंस व्हिच इज स्पेसिफिक दैट वी कैन रिमेंबर हियर. दे आर मोस्टली ट्रीटिंग फॉर द ग्राम नेगेटिव. देखिए, पेनिसिलिन, सेफालोस्पोरिन, दे वर डेवलप्ड फॉर कवरिंग द ग्राम पॉजिटिव, व्हाइल द एमिनोग्लाइकोसाइड्स दे वर वन व्हिच इज रिस्पांसिबल फॉर कवरिंग द ग्राम नेगेटिव. ग्राम नेगेटिव कवर करने के लिए बनाए गए थे. एंड यस, द बिगेस्ट इश्यू जो है उसमें ये है कि ये एब्सॉर्ब नहीं होता है ओरली, इसी वजह से वी आर गिविंग इट थ्रू द पेरेंट्रल रूट. सो ये सिस्टेमिक हमने लिखा है. सिस्टेमिक का मतलब सिस्टम में जाने के लिए. तो सिस्टेमिक मीन्स दे आर बीइंग गिवन थ्रू विच रूट? पेरेंट्रल. पेरेंट्रल मीन्स इंजेक्शनल रूट से दिए जाते हैं. सो दैट इज अबाउट एमिनोग्लाइकोसाइड. नेक्स्ट इज मैक्रोलाइट्स. मैक्रोलाइड्स, मैक्रोलाइड्स कैसे आइडेंटिफाई करेंगे? हाउ डू यू आइडेंटिफाई इट? बाय द आइडेंटिफिकेशन ऑफ थ्रोमाइसिन, थ्रोमाइसिन, रॉक्सीथ्रोमाइसिन, क्लैरिथ्रोमाइसिन, इरिथ्रोमाइसिन, ये सारे हैं ना, इसमें बहुत सारे इंपॉर्टेंट हैं। क्या याद रखना है पता है इसमें? आपको क्या याद रखना है? तो द थिंग इज यू नीड टू रिमेंबर हियर इज दिस एजिथ्रोमाइसिन एंड क्लैरिथ्रोमाइसिन, they are also being used into the a specific indication called as मैक। मैक में यूज होता है, क्या है मैक? माइकोबैक्टीरियम एवियम कॉम्प्लेक्स। क्या है ये कौन सी ऑर्गेनिज्म है? दैट इज अ सुपर इन्फेक्शन ऑर्गेनिज्म विच इज अकरिंग इन द टीबी। जिन लोगों को टीबी हुआ है ना, उनमें एक कॉम्प्लिकेशन होता है जिसका नाम है मैक इन्फेक्शन। मैक का मतलब क्या है? मैक का मतलब है माइकोबैक्टीरियम एवियम कॉम्प्लेक्स, और उसमें हम एजिथ्रोमाइसिन या क्लैरिथ्रोमाइसिन को यूज करते हैं। क्लैरिथ्रो इज ऑल्सो बीइंग यूज्ड हियर, एजिथ्रो कैन बी ऑल्सो बी यूज्ड। सो ये मैक इंडिकेशन, दैट इज अ स्पेसिफिक यूज, राइट। और ये क्या कब होता है? तो ये होता है टीबी के कॉम्प्लिकेशन के तौर पे। जिन लोगों को टीबी हुआ है ना, टीबी या ट्यूबरकुलोसिस, उनमें कॉम्प्लिकेशन के तौर पे ये इन्फेक्शन होता है, सुपर इन्फेक्शन के तौर पे, राइट। सुपर इन्फेक्शन यू माइट हैव हर्ड अबाउट इट। सुपर इन्फेक्शन क्या होता है? व्हाट इज सुपर इन्फेक्शन? Super infection means it's a secondary infection that is occurred during the treatment of first infection, या तो प्राइमरी इन्फेक्शन। जैसे कि अगर किसी को एक इन्फेक्शन हुआ, डायरिया जैसे हुआ, और डायरिया के ट्रीट करने के दौरान अगर उसको दूसरा इन्फेक्शन हो जाता है, दैट वुड बी कॉल्ड एज सुपर इन्फेक्शन। सो इफ यू आर ऑलरेडी ट्रीटिंग द नंबर वन इन्फेक्शन and during the treatment of the number one infection, second infection is being appeared, that is called as secondary और सुपर इन्फेक्शन उसको बोलते हैं। तो ये मैक का जो इन्फेक्शन है ना, वो सेकंड इन्फेक्शन और सुपर इन्फेक्शन है, और उसमें हम क्लैरिथ्रोमाइसिन या एजिथ्रोमाइसिन को एज अ ट्रीटमेंट यूज करते हैं। Why they are being named as macrolide? Because they have the macrocyclic lactone ring. That is the reason. These are the molecules. How do you identify them? You can identify them by remembering the thromycin. Thromycin, yes, thromycin के तौर पे आप याद रख सकते हो। क्या है मैकेनिज्म? हमने याद रखा था एक नेमोनिक याद रखा था, क्या था वो? CM50। CM50 का मतलब क्या? C stands for chloramphenicol. Yes, C stands for chloramphenicol. And what is M for? What is M? M for क्या था? मैक्रोलाइड। यस, उसके अलावा भी मैंने आपको दो नाम याद रखने को बोला था, क्या था? चलो बताओ क्या नाम था? तो एक था क्लिंडामाइसिन, क्लिंडामाइसिन, और दूसरा क्या था? लिनेजोलिड। दे आर ऑल्सो इनहिबिटिंग द प्रोटीन सिंथेसिस by making a combination with the 50s ribosomal subunit, and these all are the bacteriostatic, right। देखिए इनका एक ही मैकेनिज्म है। अब एक ही मैकेनिज्म है तो क्या होगा? क्या होगा? स्टेटिक, क्योंकि ये प्रोटीन सिंथेसिस को इनहिबिट कर रहा है। अगर ये सेल वॉल पे काम नहीं कर रहा है, ये प्रोटीन सिंथेसिस को इनहिबिट कर रहा है। सल्फोनिमाइड्स हैं, देखिए सल्फोनिमाइड्स में, सल्फोनिमाइड जो है वो मेटाबॉलिज्म पे काम करता है, तो वो बैक्टीरियोस्टेटिक है अगर वो सिंगल यूज हो तो। लेकिन अगर हम उसको क्वाट्रीमोक्साजोल के तौर पे कॉम्बिनेशन में यूज कर रहे हैं, तो वो दो ड्रग्स यूज कर रहे हैं साथ में, तो इसकी वजह से उसका बैक्टीरियोसिडल इफेक्ट आ रहा है। बट अगर आप अकेला यूज करते हैं तो दैट वाज अ स्टेटिक, क्योंकि मेटाबॉलिज्म को इंटरफियर कर रहा है। चलो यहाँ पे देखिए, मैंने आपको बताया था ना, क्यूटी प्रोलोंगेशन, दैट वुड बी अ स्पेसिफिक साइड इफेक्ट दैट हैज बीन ऑब्जर्व्ड ड्यूरिंग द फ्लोरोक्विनोलोन्स, दैट हैज आल्सो बीन ऑब्जर्व्ड विद द मैक्रोलाइड। इरिथ्रोमाइसिन में भी ये आता है, क्यूटी प्रोलोंगेशन। फ्लोरोक्विनोलोन्स एक CYP एंजाइम को इनहिबिट कर रहे थे। व्हाट वाज द नेम ऑफ दैट CYP? दैट वाज CYP 182, राइट। CYP 182 इनहिबिशन कर रहे थे कौन? फ्लोरोक्विनोलोन। जबकि मैक्रोलाइड जो है, दे आर इनहिबिटिंग द एंजाइम कॉल्ड एज CYP 3A4। CYP 3A4 inhibitors हैं ये, right? The another adverse effect could be the epigastric pain. That is all okay. So here you can remember these two specific point. One is CYP 3A4 inhibition, another is QTC prolongation. The other have the hepatitis and hearing ototoxicity is also present here. So that can be helpful to you if it is being asked. Vancomycin is also an ototoxic agent. देखिए, macrolide is ototoxic. देन एमिनोग्लाइकोसाइड, दे आर आल्सो ऑटोटॉक्सिक। ऑटोटॉक्सिसिटी में सबसे ज्यादा किसका है? एमिनोग्लाइकोसाइड्स का। लेकिन अगर आप एमिनोग्लाइकोसाइड्स के साथ अगर आप मैक्रोलाइड्स कंबाइन कर रहे हो, तो दैट कैन इंक्रीजेस द ऑटोटॉक्सिसिटी। वेंकोमाइसिन भी ऑटोटॉक्सिक है, वेंकोमाइसिन, यस वेंकोमाइसिन। उसके अलावा टेट्रासाइक्लिन भी है, उसमें भी ऑटोटॉक्सिसिटी है, दैट कैन आल्सो डैमेजेस द ईयर। सो दिस इज अबाउट द मैक्रोलाइड्स। नेक्स्ट, ब्रॉड स्पेक्ट्रम, जो हमने ब्रॉड स्पेक्ट्रम लिखे थे इन द बुक, के हिसाब से, राइट, जो ओल्डर जनरेशन में पहले टेट्रासाइक्लिन एंड क्लोरमफेनिकोल दो ही मॉलिक्यूल हमारे पास थे. Let's see the examples क्या है. Tetracycline is a whole category, right, in which we have the tetracycline molecule itself as well. Tetracyclines is a broader category, it's a whole category. ये cyclines हैं जिसमें टेट्रासाइक्लिन खुद एक मॉलिक्यूल भी है, डॉक्सीसाइक्लिन भी है, मिनोसाइक्लिन, ऑक्सीटेट्रासाइक्लिन, डेमेक्लोसाइक्लिन. व्हाट इज द मैकेनिज्म हमने याद रखा था 80-30. So aminoglycoside and tetracycline, they are binding with the 30s ribosomal subunit inhibiting the protein synthesis. What is the specific adverse effect? देखिए बहुत सारी एडवर्स इफेक्ट्स हैं और ये सारी एडवर्स इफेक्ट्स हमारे लिए काम की हैं. पहला है क्या, दे आर प्रोड्यूसिंग द सिम्टम्स लाइक अ सूडो ट्यूमर सेरेब्री. मीन्स ऐसे फॉल्स सिम्टम्स प्रोड्यूस कर रहे हैं जैसे कि ब्रेन में कोई ट्यूमर हो. दैट इज कॉल्ड सूडो ट्यूमर. सूडो का मतलब फॉल्स, ट्यूमर का मतलब ट्यूमर, सेरेब्री का मतलब ब्रेन. तो ब्रेन में ट्यूमर हो ऐसे फॉल्स सिम्टम्स प्रोड्यूस होता है, एंड दैट वुड बी द स्पेसिफिक एडवर्स इफेक्ट. Yes, they can have the capability to produce the ototoxicity. Because of that, they can produce the tinnitus. They have the photosensitivity reaction. They can suppress the bone growth. And इसी वजह से हम children में नहीं देते, specifically below the age of 8. We are not giving the drug to the children. And teeth discoloration होता है इसकी वजह से, वो भी हम देखते हैं इसमें. स्पेसिफिक एडवर्स इफेक्ट हिपेटोटॉक्सिक है. इसोफेजियल अल्सरेशन है. तो इसकी वजह से क्या करता है पता है, ये एडवर्स इफेक्ट जब होती है ना किसी ड्रग में, कि जैसे इसोफेजियल अल्सरेशन है, तो इसका मतलब ऐसा जब भी कोई पेशेंट ले तो उसको फिर लेटना नहीं है. पेशेंट हैज टू सिट और स्टैंड फॉर एटलीस्ट 30 मिनट. 30 मिनट खड़े रहना है या तो बैठना है. दवा लेने के बाद उसको इमीडिएटली सो नहीं जाना है. क्या करना है, अगर आप कोई पेशेंट को ऐसा एडवर्स इफेक्ट है एंड यू आर गिविंग अ ड्रग, you have to tell the patient that you have to be in a standing position or a sitting position for at least 30 minutes after taking the medicine. You cannot sleep otherwise. तो क्या होगा कि वो दवाई esophagus में ही रह गई तो chances of toxicity would be higher. Yeah, the vestibular toxicity, that is also ototoxicity, which is more with the minocycline. देखिए यहाँ पे मैंने minocycline का नाम लिखा हुआ है स्पेसिफिकली, तो इसका मतलब क्या हुआ कि minocycline के अंदर ये टॉक्सिसिटी ज्यादा है. इसका वेस्टिबुलर टॉक्सिसिटी, इसका मतलब क्या लिखेंगे इसको, वी कैन ऑल्सो कॉल्ड इज एन ऑटो का मतलब ईयर, राइट, ऑटो टॉक्सिसिटी. ओके, व्हाट इज द contraindication? The contraindications are, we cannot give this medicine to the children below 8 years, we cannot give into the pregnancy, we cannot give into the patient who is having the severe kidney or liver damage. We can the doxycycline is also having this some skeletal muscle relaxant property, and because of that we cannot use them in the myasthenia gravis. Very much important. क्या 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 इंपॉर्टेंट है यहाँ पे, द डॉक्सीसाइक्लिन इज हैविंग द न्यूरोमस्कुलर ब्लॉकिंग इफेक्ट. देखिए ये स्टार मार्क किया ना, इसका मतलब इंपॉर्टेंट क्या है, इंपॉर्टेंट, डॉक्सीसाइक्लिन इज हैविंग द न्यूरोमस्कुलर ब्लॉकिंग इफेक्ट. तो क्या, अब न्यूरोमस्कुलर ब्लॉकिंग इफेक्ट है और अगर आप उसको मायस्थेनिया ग्रेविस में दे रहे हो, द कंडीशन विल वर्स. Because myasthenia gravis is a situation where the antibodies are being formed against the nicotinic receptors, and इसी वजह से क्या होगा, अब NM receptor के अगेंस्ट में एंटीबॉडीज बनेगी, the person could not walk क्योंकि वहां पे मसल का कॉन्ट्रैक्शन होगा ही नहीं. तो इसी वजह से वीकनेस आ जाती है इसमें मायस्थेनिया ग्रेविस में. सो अगर उसमें आप डॉक्सीसाइक्लिन दे रहे हो तो कंडीशन वर्स्ट होने होगी. दैट इज द रीजन. ओके, नाउ लेट्स सी क्लोरमफेनिकोल. क्लोरमफेनिकोल जब भी हम सुने ना तो आपको ये मगज में आना ही चाहिए, क्लोरमफेनिकोल का मतलब ग्रे बेबी सिंड्रोम. बट दैट इज वेरी स्पेसिफिक एंड वेरी वेरी इंपॉर्टेंट. ये बहुत कॉमन हो चुका है, ग्रे बेबी सिंड्रोम इज अ वेरी कॉमन. लेकिन इवन दो मेनी पीपल आर नॉट नोइंग, so you just have to remember it. Whenever you see about the chloramphenicol, the first thing that come into your mind, that must be gray baby syndrome. Gray baby syndrome, and another would be the bone marrow depression. Bone marrow depression, these are the two specific adverse effect which is associated with it. chloramphenicol, इसी वजह से इसमें चिल्ड्रन में ये प्रॉब्लम इसमें होता है. और ग्रे कलर इसका एक्चुअली मेटाबोलाइट है that get accumulated into the baby skin, and that is why the color of the baby would become gray. So that is the reason why we call it as a gray baby syndrome. And this chloramphenicol is a protein synthesis inhibitor. हम लोगों ने याद रखा था, क्या याद रखा था, CM50 क्लोराम्फेनिकॉल मैक्रोलाइड. उसके अलावा भी दो नाम याद रखे थे, लिनेजोलिड एंड क्लिंडामाइसिन. ठीक है, ये याद रखा था ना, फिर से रिवाइज कर दिया. देखें, नाउ दिस इज अनदर थिंग, डोंट वरी, वी हैव ऑलरेडी cross the 11, but we will not take more than 5 or 10 minutes more, right? We most of the antibiotics or antimicrobials that we cover here, this say all the content that I've taken from the KDT only. KDT, this is Dr. KD Tripathi, Essentials of Medical Pharmacology, is one of the very much good book that I'm preferring, and I really love to read it, and I would also suggest you to read through that book only. uh, ठीक है, तो दिस इज द एंटीमाइक्रोबियल। आपको यहाँ पे क्या है, यहाँ पे आपको याद रखना है कि अगर किसी को किडनी डैमेज है तो विच आर द मोस्ट किडनी टॉक्सिक ड्रग्स एंड इन विच कंडीशन, लाइक समवन इज हैविंग द माइल्ड रेनल फेलर, मॉडरेट रेनल फेलर या सीवियर रेनल फेलर, तो कौन सी ड्रग्स हैं वो नहीं देनी है, कौन सी देनी है। तो यहाँ पे जो हम नहीं देनी है ना, वो ड्रग का नाम लिखा हुआ है, तो इसका मतलब जिसका नाम नहीं है वो आप दे सकते हो, ठीक है। चलो यहाँ पे हम बात कर रहे हैं दोज ड्रग्स विच रिड्यूस, यू नीड टू रिड्यूस द डोज। कौन सी ड्रग्स में आपको डोज कम करना है, इवन द पेशेंट इज हैविंग द माइल्ड फेलर, तो ये सारी है, जैसे कि एमिनोग्लाइकोसाइड, दे हैव द नेफ्रोटॉक्सिसिटी, सेफालोस्पोरिन, दे हैव द नेफ्राइटिस एडवर्स इफेक्ट, वेंकोमाइसिन इज आल्सो नेफ्रोटॉक्सिक, एम्फोटेरिसिन भी ये पोटेंट मोस्ट टॉक्सिक, राइट, इथाम्ब्यूटॉल टॉक्सिक, फ्लूसाइटोसिन, तो ये सारी टॉक्सिक हैं। तो अगर पेशेंट को इवन माइल्ड रेनल फेलर है तो भी आपको यहाँ पे उसका डोज कम करना पड़ेगा, दैट्स वेरी इंपॉर्टेंट, ठीक है। और कौन सी कंडीशन है, जब सीवियर होगा तभी, सीवियर या तो मॉडरेट कंडीशन में ही कम करना है, तो दिस आर द मेट्रोडाजोल, कॉट्रिमोक्सोजोल, एस्ट्रियोनाम, मेरोपिनम, देन कार्बासिनिन, फ्लोरोक्विनोलोल, क्लेरिथ्रोमाइसिन, इमिपेनम, दिस आर द ड्रग्स व्हिच कैन बी गिवन इन द माइल्ड रेनल फेलर, and that dose can be reduced only in the conditions of like moderate to severe. So इसका मतलब mild renal failure होगा तो that would be all okay, we don't have any problem with that in case of mild renal failure. But there are few drugs that need to be avoided, right, that need to be avoided कि भी वो आपको देना ही नहीं है रेनल फेलर में। कौन सी है ऐसी, क्विनोलॉन्स में कौन सी ड्रग थी हमारे पास, एक ही थी, व्हाट वाज दैट, नैलिडिक्सिक एसिड, नाइट्रोफ्यूरांटोइन, यस दैट इज एन यूटीआई, नाइट्रोबेंजीन डेरिवेटिव है और यूटीआई इन्फेक्शन में यूज करते हैं नाइट्रोफ्यूरांटोइन, दैट वुड बी अवॉइडेड, टेट्रासाइक्लिन दैट वुड बी अवॉइडेड, बट एक्सेप्ट वी कैन गिव द डॉक्सीसाइक्लिन, तो ये एक्सेप्शन वाला है ना, दैट इज इंपॉर्टेंट, डॉक्सीसाइक्लिन कैन बी यूज्ड इनटू द पेशेंट हु इज हैविंग द रेनल फेलियर, so that is exception। चलो लीवर डिजीज में कौन सी नहीं देनी है, तो ड्रग्स नीड बी अवॉइडेड, इरिथ्रोमाइसिन, स्टोलेट, दैट इज सॉल्ट ऑफ इरिथ्रोमाइसिन लाइक स्टोलेट, वो नहीं देना है, पेरिजेनामाइड इज हेपेटोटॉक्सिक, टेट्रासाइक्लिन, नैलिडिक्सिक एसिड, पेफ्लॉक्सासिन, सो पेफ्लॉक्सासिन, दीज आर द अवॉइडेड। कहाँ पे डोज कम करना है, क्लोरामफेनिकोल, मेट्रोडाजोल, क्लिंडामाइसिन, आइसोनियाजाइड, डोफाम्पिसिन, सो दिस इज व्हाट वी कैन डू। ये मैंने पोस्ट लिया फिर से अपने अपने इंस्टाग्राम अकाउंट से, सो व्हेन यू गो फॉर द इंस्टाग्राम आईडी you can find this kind of post there, and these are the few important things कि भी this is the condition, कौन सी drugs would be the first priority, so here I mention everything, you just go through it and you can read it through, right? So all the 358 posts which I've already posted on the Instagram ID, you just go through it, this all post would be very helpful, so these all are very important for us, and you shouldn't miss it. So these all posts, right, I've just taken an example here, देखिए मैंने मैक की बात करी थी ना, मैक, माइकोबैक्टीरियम एवियम कॉम्प्लेक्स, which is a complication that occurs into the TB patients where azithromycin, clarithromycin would be a first choice, other than that rifabutin can also be given. So ये सारी चीजें हैं that see pertussis, whooping cough, Bordetella pertussis, that is an organism, Bordetella pertussis, that is also known as whooping cough, whooping cough में क्या आता है, azithromycin would be the first choice। तो ये सारे काम के कंटेंट है जो आपको एग्जाम में एमसीक्यू में जीपेट में काम आएंगे, सो जस्ट रिवाइज इट, राइट, ठीक है। यस, दिस इज माय इंस्टाग्राम आईडी, व्हेन यू ओपन इट, pharmacology_guru, right, this is what you see, and if you haven't followed, just follow it। This is my contact detail, if you found any queries related to the content, or if you have any question or you want to understand कि sir I don't know about this and I'm having the query, you can WhatsApp me, or even you can email us on our official email ID, right? So this is our website, this is actually our mobile application which is a Walk Pharma, this is our second Pharmacology Guru is a main one, but we have the another mobile application available, that is a Walk Pharma Education, through which we have the various courses available, but it's a paid courses, right? But it's very important as for your examination. If you want to see, then you can use it. This is Google Play Store, so you can do. So what I've taken the all the content which we mentioned here. It is only from the KDT, and I've used the latest edition, right? This is the latest edition of the KDT, and we always prefer कि आप latest edition को ही prefer करो. So this is the content which I've taken from it. So this is all related to the today's lecture. What we have done is we've divided the pharmacology into the 6 portions. One is a antimicrobial that we've seen today. The other is a CNS, drugs acting on CNS, that we are going to on the next day. Then drugs acting on ANS, drugs acting on autocoids, that is autocoids and general pharmacology we'll see together. Then drugs acting on the endocrine and drugs acting on CVS, that will be the last. So these are the 6 topics that we will cover before our examination. Antimicrobials that we've already seen, right? CNS we'll see in the next class. ANS, then autocoids and general pharmacology, endocrine and CVS. Okay. Yes, there are few chapters that from the chemotherapy we haven't mentioned, like the antitubercular drug, the TB है, leprosy है, then anti-amoebic है, anthelmintic है, मलेरिया है, वायरल है, फंगल है, कैंसर है. ये सारी चीजें हमने अभी नहीं कवर करी है, but if we'll get a time, we'll try to cover that topic as well, and what are the important things in it, we'll make a PPT of it, and we'll do it, right? You have the time that you can skip this video and you can take a screenshot and read it out through it, so that can be done. So that is all from the today's lecture. We'll see you tomorrow evening at 10 p.m. and we'll cover it. Thank you guys.